Oh my God. How could it be that good? We have a very young 77-year-old, previously a track and field coach for Brigham and Young and San Diego State. So he's very active and remains so, but you can just see the toll it took on his spine. So he's got some degenerative scoliosis, L3-4 lateralisthesis, 4-5 spondylolisthesis, and 3-4 is also really collapsed. And on flexion extension views, you can see that there's some motion with more radiculopathy and a vacuum phenomenon at 3-4, and severe neuroforaminal stenosis. And 4-5, you can see the vacuum phenomenon and severe degenerative disc disease. The MRI at 3-4 shows end-plate modic changes, disc space collapse, buckling of the ligamentum flavum. It doesn't look that bad here, but the neuroforaminal stenosis is tremendous. And then at 4-5, there's severe stenosis, facet cyst, hypertrophic facet joints, facet fluid sign. Just looking at it makes my back hurt. So he's not improved with a variety of non-operative treatments, and I think because he's so healthy, he's been able to last for a lot longer than most people. But it's gotten to the point where he just cannot have meaningful activities in life, and he's very active. So we'll fix this problem through a minimally invasive T-lift technique. We want to realign everything, jack everything back up to a more normal height, pull this back, and open up all the space for the nerves and treat all these facet joint arthritis problems. We'll put in a spacer, and we'll use a variety of expandable spacers that will let me customize and dictate the perfect implant for this particular, for each particular disc space. And I'll know exactly which cages to use once I do the discectomy, release the disc, and start opening it back up. So we're all really excited. All right, we're getting started. You can see how much equipment there is for setup. So that is the computer navigation tracking system. There's the satellite camera. It's going to look down on the patient, and Jen just assembled the patient navigation tracking pin so that that camera can see down to here. And behind there, there's Big Tony and the big O-arm that will take the three-dimensional spin. And with that, I'll be able to know exactly where I am at any time continuously in three-dimensional space with three-dimensional navigation. And basically, it's like cheating, but my mama always said, if you don't cheat every once in a while, you ain't trying hard enough. All right, we're getting started. I have my 2 incisions. There's so much arthritis in here, but we knew that. Just feeling around, because my finger is the most delicate instrument that we have. My poor delicate Asian fingers are taking a beating though. Putting in the bone graft through these little percutaneous plungers. All right, now I'm creating the pedicle screw track to put in the screws into this bone. You can see what the pedicle bone is. It's like a little tunnel. And this allows me to get a precise entry point. God, I feel like I'm cheating. I don't know if you can see the screen though, but look at this entry point to this pedicle at 5. It's usually really easy, right at the junction of the TP and the supraarticular process, but look at that TP. It's not even a TP. It's almost like a little afterthought. And then there's a huge facet joint right in my way, and I basically have to perch it right there. If I had to use a jam sheeting needle to get in here, it would slip off over and over again, either go in the facet joint or go out laterally. Huge advantage of this technique. Okay, so this is the sound. We call it the thoracic pedicle probe, but I use it in the lumbar spine. It opens up this space and finds the pedicle track. You may have to adjust the camera again. Okay, putting in the screws now. Magically finds that screw track, I guess because there's nothing else that it can go into. And you can feel it. Ooh, you've got good bone. That means you're healthy and active just the way you should be, so great work. Oh shit, you're right, thank you. Okay, I'm at the first, I've got all the screws in, I'm at the first level at 3-4. I start at the top and work my way to the bottom. And I'm just exposing the surgical target site. The surgical target site's only about this big. So the incision should only be slightly bigger than that. When we do open surgery, we make a huge incision, look down into this little area. So it doesn't make any sense to me, but I'm trained as an open surgeon. So yeah, if I was trained one way, that's the way I rely on. But I'm about making the surgical corridor matched up with the surgical target site as much as possible. And that's one of the basic tenets of minimally invasive surgery. Navigation dilator. All right, we have the new Sable cage, which is the hyperlordotic, massive expansion, way prettier, way shinier, way more sophisticated. It's got 3D printed end plates, so these are all like 3D printed so that the nooks and crannies match up. It looks like it's gold plated, which obviously it isn't, it's just yellow, but it's like I had like 2 big buck teeth with gold plating on it. And look how wide it is. And the lordosis is going to be, I don't know, obscene, I guess.
Then you're gonna swim? Yeah.
All right, so I've got it attached to the inserter, so it's in line.
We're gonna grab it.
Okay, look at this.
Okay.
Interbody erection right here, but look how lordotic that is. That's a real 15 degree of lordosis if I've ever seen it. Oh, I don't know what I'm going to do with myself. This thing is wild. Look at that. That's real lordosis. This is just a 15. There's a 22 also. The massive graft window. This thing is a gorgeous implant. I'm going to have a cigarette after this. Okay, we're going to definitely use this implant. Let me do the inner body prep. All right, putting in this new implant called Sable. It is probably the absolute top of the line implant right now. Don't ask me how much it costs. No speak English. God, it's beautiful though. And it went in at, I think, a 7. It's going to go all the way up to a 14. With a true 15 degree lordosis. It's going to be something else. Cage, and it went in really easily because it's so small to start with. Only 7 millimeters. Once you get past 8 millimeters, it's really hard to get past the exiting nerve root. I've got this expander, and now I'm going to just slowly expand. Ooh, really good tactile feedback. I can feel the resistance already. Shot. It's getting bigger. Bigger still. Getting some resistance. Oh, that thing looks massively tall in the front, just the way we like it. Lots of resistance. Shot. Still getting bigger. The greed be a powerful force. Look at that, it's like a fan. This is going to be the absolute sexiest inner body implant on the market right now. If it's my vote. Oh. Right, other next cool feature, this is a plunger with flowable bone grafts. Starts with an I and ends with a factor, in case you're wondering what it is. I love that.
That is awesome. What is that, Dr. Kim?
That is the sexiest interbody reconstruction I've done to date. Look at that thing. Okay, doing the next level, L4-5. This is the worst level. Lots of arthritis, but you're going to be so much taller. I can't wait. I should hit this without this first. Okay, second cage. Oh, it goes in so smoothly because it's so thin and sleek. Bring in the X-ray. Okay, putting in the second cage. Beautiful, sleek, sexy, for sure. I think I love this cage. There's going to be another sexy mama. Really good tactile feedback too. I think the mechanism is a lot more sensitive to the surgeon because I can really feel this getting tighter, whereas on the rising caliber I can just go until the torque wrench tells me to stop. This I can really feel. That's my story, I'm sticking to it. And this looks perfect. Oh, I don't know what I'm going to do with myself. Oh my God, that is so beautiful. This is going to be, people are going to run to this implant like it's gold, like in the gold rush. How much you want to make a bet? How much you want to make a bet we're going to get 50 million people saying something about this post? Because if it was me, I would. Oh my God. How could it be that good? You should go look at the implant. It's just a beautiful implant. It's got 3D printed end plates. It's smooth, it's sleek, it goes in smooth, it's... Oh.
How's the case going so far, Dr. Kim?
It is going spectacularly. The bone is so strong. We've got all the screws and implants in. You're going to feel so much taller. I can't wait. Surgery's all done. We did it through two 1.5-inch incisions and a little poke hole for the computer navigation tracking pin. We're putting in some skin glue and a shower resistant dressing. The surgery went beautifully. All righty, surgery's all done. Here's the radiographic summary. The first thing I do is put in the screws using the nav drills technique, which I love. Here's the lateral, and then once I have all this in, I take the rod extension sleeves off, so you just got the screw, and then I do the inner body, so you can see the screw has the tulips removed, so I can work unimpeded. Here's the cage, and I don't know if you know, but when we started, this was just bone on bone. And now, with the expansion device, with the new Sable, look at the magnitude of this expansion and the focal lordosis. You ready? Bigger, taller, faster. You can see the bones moving too. Look at that lordosis. You can still see the bones moving. Look at the lordosis before and after. It's crazy. And then here's the next level. Same thing. It was bone on bone, grade 1 spondy. There it is. Bigger, taller, faster, stronger. Oh, wait a minute. That's something different. But look at that. That is the sexiest cage alive, right there. Here's the final AP, much straighter than before surgery. And the lateral, let me get a better lateral, look at that. Love that. Maximal lordosis, minimum insertion height. That's love right there.